I really think that we were made for service. I think it's where we find our greatest worth. I think it is why we live in community, is because we are supposed to serve together.
Dr. Scott's been here at Redmond for 16 years, very concerned about his patients, very attentive to his coworkers, a very generous person, a wonderful family man, a great community servant. I can't say enough good things about him.
Dr. Scott served on our credentials committee for 7 years. He is always going to think through the right thing to do, the most ethical thing to do. We were able to develop a very strong enhanced surgical recovery program really before it was a focus.
We've been able to put together an ERAS program facilitating a patient's throughput through a surgical experience. And the way we accomplish that is by breaking down silos.
Ryland is very aware of others. Unfortunately, there are far more children in Floyd County in need of foster care than there are parents willing to step up and provide those services. So Dr. Scott and his wife Jennifer became foster parents. And now over the years since they've done that, they fostered 8 children.
Seeing Dr. Scott in the community with his family has been not anything short of inspiring. Dr. Scott has been involved with Restoration Rome, a fantastic organization that has really brought together the resources in this community like none other.
Restoration Rome is really the result of massive collaboration between public, private, and faith-based partners for foster care. Ever since I've known Ryland, he's had a heart for kids and doing whatever he can in this community.
I was talking through some of this with my wife. She said, you know, when I hear you talk about ERAS, you're basically talking about Restoration Rome. With ERAS, what we look to do is shorten the length of stay, minimize the pain, enhance the recovery, get them back on their feet again. With Restoration Rome, it's the same thing. We're taking broken, damaged families, and we bring together a bunch of resources to restore their family and get back on with their life.
I see in Dr. Scott exactly what I think probably existed in Dr. Frist Sr., that humanitarian instinct, that determination to do what he can to improve the lives of others.
If you value the individuals you interact with on a daily basis, then service should just flow from that. I don't think of it as giving of myself towards service. It is rewarding for me to be able to serve.